Hello, I'm Dr. Sundari Mase, Sonoma County's health officer, and I'm here to share the latest updates on coronavirus in Sonoma County with you. As of yesterday, June 16th, we have 774 confirmed cases, 348 active, 422 recovered. We still have the 4 deaths that we've reported, and we've performed a little bit more than 36,000 tests to date, with 493 of those in the last 24 hours. Today, I want to talk a little bit about the Latinx COVID-19 data, specifically about the disproportionate numbers of COVID-19 cases impacting Sonoma County's Latino Latinx community. This has been a focus of a lot of recent news coverage and community discussions, and we're really moving to address this very sad disparity that we're seeing in this group that just sort of unearths some of the underlying disparities and inequities that exist in our community. Our local case data reflects what we already know, that communities of color generally endure more health conditions than communities that are not. This is not a matter of any sort of behavior. The data point to the structural inequities across our county that communities of color experience, such as lower incomes, lack of access to health care, inadequate and crowded housing conditions, including having multiple families in one home due to the high cost of living. All these things impact people's health. And of course, those kind of crowded conditions are not good for the transmission of infectious disease like COVID-19. The COVID-19 pandemic is just further these disparities in much the same way as in the past. Both data and history show that during public emergencies and disasters in our country, people of color are disproportionately impacted, and Sonoma County is no exception. When we first began reporting data by ethnicity in our dashboard, 59% of all positive cases were in the Latinx community. As of today, 76% of all COVID-19 positive cases are in the Latinx community. This is definitely a cause for extreme concern. However, this increase in percentage is partially due to our own testing efforts. When we saw the disparity 3 to 4 weeks ago, we performed intensive testing with pop-up testing type sites for the Latinx, extensive contact investigation among the Latinx families and work sites. And I think that really led to us detecting more cases, and that's why we have even more disproportionate numbers in the Latinx currently. One important factor also that contributes to this disparity in the Latin is that the Latinx community members are more likely to be employed in the essential workforce that required work outside their homes to support their families, even when everyone else was sheltering in place during the pandemic, COVID-19. Working in home was not an option for our essential workforce. However, it is important to note that data indicate that workplace transmissions account for less than 10% of cases currently. So here's some things we're doing in response to these realities. We're hiring bilingual, bicultural staff to support our COVID-19 response, including contact tracers, nursing staff, and intake workers for our alternate care sites. We're meeting weekly with leaders in the community to answer questions and provide guidance. In addition, we're making testing more accessible, as I just noted, specifically to Latinx communities in many locations, including Roseland, Petaluma, Grayton, Hillsburg, Cloverdale, and the Sonoma Valley. Finally, we're providing important information through Spanish language media. I also want to spend a minute talking about testing. I'd like to highlight the importance of testing for the virus. Testing is a critical step towards reopening the county as it increases our understanding of COVID-19 community transmission. While it's true that the more we look, the more likely we are to find cases of COVID-19, it's also true that the more we find the cases, the more we can contain the outbreak. This is especially important as we await a vaccine and proven treatments. There are several ways to get a COVID-19 test. OptumServe that is given to us through the state for testing of anybody who wants is operating 2 sites, one in Petaluma and one in Santa Rosa. You need to schedule an appointment on their website, lhi.care/COVID testing, or you can call 188-634-1123 if you do not have internet access or if you speak a language other than English. Testing at these sites is open to all residents of Sonoma County. The Department of Health Services and Public Health has a drive-through site in Santa Rosa for priority populations that include essential workers and high-risk residents with symptoms. We know that up to 1/3 of people who test positive for COVID experience no or very mild symptoms, but they can still be contagious. That's why we encourage everyone to take advantage of the COVID-19 testing available in the county. So call OptumServe and get your test as soon as possible. Our community question for the day is, it seems like face coverings are optional based on what I'm seeing on the news and in the streets. Is that true? As our community opens up more and more, it's easy to both hope and get the feeling that we're ready to go back to normal, the way it was before COVID-19. As much as we all wish that were the case, the virus is still here and easily passed from one person to another. One effective way to reduce the spread of the virus is by wearing your face coverings whenever you are out of your house or yard and cannot keep 6 feet of distance. This includes both indoor and even outdoor spaces. If you're in an indoor space like a grocery store, or if you're going to get your hair cut, you certainly should wear a facial covering. So if you take a walk on the beach or in a park, take that covering with you and have it ready to put on when you get close to others and cannot social or physical distance. Make sure to put on the face covering before you enter indoor settings. Remember, using a face covering over your nose and mouth doesn't protect you. It protects others from you in case you have COVID-19 and you're one of the asymptomatic people. And it does show that you care about other people's health and the health of our community. And we hope that they will care about yours. Please model this considerate behavior wherever you go, especially now that Sonoma County may be a host to visitors from other areas. This way, they'll know that it's the norm and a requirement in Sonoma. Okay, thanks for joining me today. Please continue to take care of yourselves, stay healthy, and we'll talk again on Friday.